Good morning, good afternoon, good evening, wherever you may be in the world, and we are so glad you could join us for the conference.
We had 503 people register for this conference from 51 countries. That is a remarkable number.
Coordination, communication, cooperation, connection. It calls for Christ to be on top of everything.
The peculiar challenge of the faith-based providers is the fact that your Christian principles make it difficult for you to turn patients away.
We see faith partners as trusted voices that could really bring messages to their communities.
And it's just a strategy of community development. So we have certain core values, like community ownership is a good one. Another one is development instead of relief. Another one is integration of physical and spiritual.
In co-creating together, we try to go to the community. The community identifies its own challenges and its own problems, and together we work together to seek for solutions.
I think an advantage that faith-based organizations have is with their connections to churches, they can have a fairly accurate sense of the technology that is available to people.
So what I hear from you is that one of the most important things is to start with the leadership of the different congregations. So a top-bottom approach.
Exactly.
When it comes to identifying, nobody does it better than the FBOs because they are much closer to the communities.
It was important to build community ownership with this project, and a way to do that was by involving the community leaders.
It is you people, they stimulate us. They come with those approach, they stimulate us. We ourselves are the one that will take the initiative and say, look, this is what we're supposed to be doing for our community.
The vision also recognizes that locally designed approaches often offer the most effective solutions for delivering higher quality healthcare to the populations in disadvantaged and vulnerable situations.
She's always used this saying that if you don't have a seat at the table, bring your own chair. If you don't have a voice or an ability to interact or partner with the government, we need to make sure that that happens, and it takes an effort from ourselves.
I reflect on what we have covered over the past 3 weeks. I'm challenged. Frankly, I'm challenged about how we can apply these messages or these principles. Think about what you're going to do differently tomorrow on the basis of this. And with that, I encourage you to get on with the work that we're given to do. We have a lot in front of us.
We look forward, of course, to being able to meet together in person again soon. But until then, we are very grateful to have this technology to bring us together now.